healthcare workers are 3 to 4 times more likely to develop COVID-19 in the country of South Africa. At the moment, the nurses as well as the doctors are currently being vaccinated in order to be protected against COVID-19. We also know that South Africa has got quite a number of people who are positive of COVID-19, with a number of deaths, with Gauteng, Western Cape, as well as KwaZulu-Natal, with the highest number of infections as well as deaths. Well, we are here in Durban at Hoy Park. This is where the doctors, nurses, of which fall under the healthcare workers in South Africa, have embarked on games, inter-hospital games, where 10 hospitals, both private and public, have come here in order to be part of the games, playing soccer as well as netball. These are the nurses who are the frontline workers who are saving the lives of South Africa on a daily basis. So they are here just to, participate in these games, just to distress and also relax. One will wonder whether they do get time in order to be part of other social activities such as playing soccer. Let me talk to one of the nurses coming from St. Augustine Hospital. How do such games help you? We know also perhaps we wonder whether you also get time to be part of the social activities as you are today here.
These games, they actually help us because they improve our mental and physical well-being. We don't really get time to interact or any social activities because we 24/7 we are at work. We work 12 hours a day, and then there's night shift. So we are always with our patients to give the extra care because of the pandemic and all this COVID stuff. So we need to always be there for them. And with all this precautions for COVID, we can't even the relatives can't even come and see their patients. So we are actually their family and also the nurses at the same time, because we have to interact with the family and the patient at the same time, just to update them of what is happening about the condition of the patient. So yeah, as nurses, we are having a hard time, but this will really help us. It will really help us.
Okay, take us through the ICU units where you actually work. How is the situation there without really revealing too much?
It's much better now. It's much better, I would say, because of the statistics are down. But with level 2, it was actually very difficult because we were experiencing something that we've never experienced before. We were seeing something that we've never seen before. With the conditions of the patients coming in, and then it just changes. All of a sudden, we don't know what's happening and all that. So it was a condition that we've never seen before. So it was a bit scary and very hurtful at the same time, because we are not just there to work, but we have that love for our patient, the care that we give them. We actually want to see them better, at the end of the day. So it was really hurtful when the condition will just change all of a sudden. But yeah, it's much better now. It's much better.
Okay, tell us about the vaccination program. How is it going? We know that currently government is vaccinating, nurses and doctors, as well as they are at the beginning stage of vaccinating the people who are older than, who are 60 years older, and those with comorbidities from 18 years.
Yes, with what I know, vaccinations are actually going through in St. Augustine's. All nurses have been vaccinated. Actually, everyone who's working in St. Augustine's, either hostesses, cleaners, everyone who is there is vaccinated. Now it's just going out there with the elderly patients, people with comorbidities, and I'm hoping that everyone will be vaccinated.
Yes. Okay. let me leave you to it. This is Luana coming from St. Augustine Hospital, playing netball here with other hospitals, of which we are told that there are 10 hospitals under eThekwini municipality. There's also a soccer game taking place between St. Augustine's here in Durban